Have you ever rushed a loved one to a hospital only to be told, "We're sorry, we can't help you right now"? Not because the doctors weren't available, not because there wasn't a bed, but because the system had changed and you no longer fit within it. In 2025, the face of the UK healthcare system is quietly shifting. On the surface, it looks like simple budget cuts, overworked staff, or longer wait times. But for thousands of immigrants living in the UK, this year feels like something far more terrifying. These aren't just service cuts. They feel like deliberate exclusions. Immigrants, many of whom have lived and worked in this country for years, some even decades, are suddenly finding themselves pushed to the very edge of the system. Behind the curtain of government press releases and carefully worded statements lies a darker possibility. Are these healthcare cuts a silent weapon against vulnerable communities? Let's begin with what changed. Early in 2025, NHS funding underwent what officials called necessary restructuring. Key services, particularly those used most by lower income and immigrant populations, were the first to feel the axe. Walk-in clinics in immigrant-heavy areas began shutting down. Maternity services were scaled back. Mental health support became almost unreachable. On paper, these changes were meant to redistribute resources. But in reality, they've left entire neighborhoods, especially those populated by immigrants, without access to essential care. And here's where it gets more disturbing. Alongside the cuts, a new policy was quietly introduced: a tiered access system. In simple terms, if you don't have settled status or proof of long-term residency, your access to care is limited, or in some cases, denied. Imagine being a mother with a sick child, told that unless you can prove your immigration status, the hospital cannot provide care beyond basic emergency treatment. It's happening, and it's not an isolated incident. Across cities like Birmingham, Manchester, and parts of London, immigrant families are reporting similar experiences. The official narrative? We're making the system more efficient. But behind closed doors, whistleblowers are speaking out. Some NHS workers bound by conscience have started leaking internal memos, emails suggesting that cost cutting should prioritize non-UK-born patients. These are not conspiracy theories. These are documents with signatures, timelines, and instructions. One leaked file from a Midlands hospital even suggested that staff discourage non-citizen visits unless critical. The emotional toll is unbearable. Elderly immigrants, many of whom contributed to the UK economy their entire lives, are now struggling to get prescriptions filled. Pregnant women are being referred to distant hospitals, some hours away, because their local services have shut down. Mental health support, already stretched thin, is now practically inaccessible for non-native English speakers. But why is this happening now? Some experts point to the economic pressures post-Brexit and the lingering impacts of the pandemic. Others believe it's political, a move to appease anti-immigrant sentiments and win votes. Whatever the reason, the effect is the same: fear, uncertainty, and silent suffering within immigrant households. Families are now second-guessing hospital visits. Parents are skipping doctor appointments for their children. Some are turning to underground or unregulated clinics because they feel they have no other option. One father from Leicester shared his story. His 7-year-old son had a high fever for 3 days. When he finally went to A&E, he was asked for documentation. After a 2-hour wait, they were told to consult a GP instead, despite the child's worsening condition. That night, the boy was rushed to the ICU. The father still wonders if they had just been someone else. Would they have been treated faster? Stories like this are becoming painfully common, and they don't just hurt individuals, they shatter trust in the system. When people feel excluded from basic human services like healthcare, they begin to feel like they don't belong at all. This isn't just about medicine, it's about identity, dignity, and human rights. Let's be clear, not all healthcare workers support this. Many are deeply uncomfortable with the direction things are heading, but when policies are set from the top, it ties the hands of those on the ground. Nurses and doctors are under pressure to prioritize based on immigration status rather than need, and that's where the tragedy lies. In the middle of all this, one can't help but ask, is this the beginning of a broader agenda? If healthcare access can be restricted, what's next? Education, housing, Employment. Is this how a slow, silent form of systemic exclusion begins? The government denies any discriminatory intent, insisting that all legal residents are treated equally. But evidence on the ground tells another story. And if we don't talk about it, if we don't expose it, the silence will become complicity. The question is no longer, are immigrants being left behind? It's, how far will this go before we speak up? If you're watching this and thinking this doesn't affect you, think again. Rights taken from one group today can be taken from another tomorrow. This is not just an immigrant issue. This is a human issue. It's time to ask ourselves, what kind of country do we want to be? One that protects its vulnerable, or one that turns away when they need help the most? The UK has always been proud of its NHS. It's time to ask whether we're still living up to that legacy. And if not, what are we going to do about it? If this video moved you or opened your eyes to something you didn't know before, please don't forget to like and subscribe. Your support helps us keep telling the stories that matter.